Today we're going to be taking a look at hypoglycemia, which is a condition where blood glucose levels fall below normal limits. Now, I have already covered this in previous videos, but just to recap the functions of insulin, what normally happens is that when we have high levels of blood glucose, it triggers the pancreas, and more specifically, the beta cells of the pancreas, to start secreting insulin. And this insulin can act in two main ways to reduce the levels of blood glucose back to normal, the first being increasing glucose uptake. So what happens here is that insulin binds its receptor, and this triggers a transporter called GLUT4 to fuse with the cell surface membrane, thereby allowing glucose to enter the cell via this transporter system. The second mechanism involves increasing glycogenesis. So again, insulin binds its receptor, and glucose is able to enter the cell. But this time upon entering, it fuses with other glucose molecules to form a long chain of glycogen, and this is useful for glucose storage. In the context of hypoglycemia, we can realize that excess insulin may cause reduced levels of blood glucose, as you can see from the diagrams where there's less glucose present in the blood, following increased glucose uptake and increased glycogenesis. Another key hormone involved in glucose control is the hormone glucagon, and what normally happens is that when we have low levels of blood glucose, it triggers the pancreas again, but this time the alpha cells of the pancreas, to start secreting glucagon. And this glucagon can act to increase blood glucose levels back to normal limits. And one of the mechanisms for this is through gluconeogenesis. During this process, glucagon binds to its receptor, and this binding process triggers other molecules such as amino acids to be converted to glucose. And then this glucose is free to enter the blood system to increase the levels. The second mechanism involves glycogenolysis, during which the binding of glucagon helps to break down the long glycogen chain into glucose monomers, and then these monomers are free to re-enter the blood system via diffusion. In the context of hypoglycemia, glucagon can be used as a treatment option to help to increase blood glucose levels for patients experiencing the condition. Moving towards the condition itself, hypoglycemia can be defined as blood glucose levels falling below 4 millimoles per liter, and it can occur in both type 1 or type 2 diabetes. In terms of the causes of the condition, the main cause tends to be drug-induced hypoglycemia, and this can be due to diabetic medications or non-diabetic medications. For the purposes of examinations, the main ones to know are insulin, sulfonylureas, and SGLT2 inhibitors, and you can always check in the BNF to work out the side effect profiles of other medications. Another central cause of hypoglycemia is missing meals or lack of carbohydrates, especially in the context of type 1 diabetes. And this can be exacerbated by increased exercise levels or alcohol consumption. Having less glucose present in the blood can lead to an array of different symptoms, and these can include dizziness or headache, as well as increased cognitive impairment. Patients may also typically experience excessive sweating, in addition to intense hunger symptoms. And some of the more common signs might include pale, clammy skin, as well as generalized weakness or fatigue. If left untreated, more severe symptoms can develop, including slurred speech, blurred vision, and seizures, so it's important to recognize and treat the condition as soon as possible. And one important point to note is that some patients may be asymptomatic in the initial phases of hypoglycemia, so it's important to recheck the blood glucose values regularly for these patients. In terms of the management of hypoglycemia, the treatment pathway used depends on how severe the symptoms are for the patient. So for instance, in cases of mild hypoglycemia, the patient is able to measure their own blood glucose values and treat this correspondingly with a fast-acting oral carbohydrate, usually around 15 grams. It's also important to recheck blood glucose values after around 15 minutes and administer another dose if required. In cases of more severe hypoglycemia where the patient's conscious and able to swallow, you can try the same as mild hypoglycemia, but you can also give 2 tubes of glucogel squeezed between the teeth, as this allows quicker administration of glucose. And finally, in instances of severe hypoglycemia where the patient's unconscious or unable to swallow, you have to adopt an A2E approach. And this usually involves giving IV 10% or 20% glucose, or intramuscular glucagon if there's no IV access present. Again, it's important to recheck values after around 10 minutes and repeat the IV glucose if required. After an acute hypoglycemic episode, it's important to give 15 to 20 grams of a long-acting carbohydrate and locate the root cause to prevent future hypoglycemic events from occurring. And here is a quick summary slide outlining everything I've gone through in the video. If you have any questions, please leave them in the comments, and I'll see you in the next video.